Welcome everyone to the Leadership in Practice session. My name is Jenise. I'm a member of the Leader in All of Us organizing committee, and I'm also a grad student in the Faculty of Nursing at the University of Calgary. So you heard from three of our panelists in our Leadership in Practice session: Tyler Burley, Michelle Charlesworth, and Faduma Robinson. We'll watch their presentations first. If you have any questions, feel free to put them in the chat, and the panelists can also answer your questions during the presentations. And then at the end, we'll come together for questions and discussion. If you have any questions or comments, just remember to put them in the chat and we will get to them. All right, let's begin.
First, thanks very much to Dr. Noel and the planning committee for bringing everyone together today. A really terrific opportunity for all of us. I've got 10 minutes to share with you my background and experience in leadership and practice and leave you with 3 takeaways to hopefully inspire the leaders in all of you. So I'm going to talk really fast. Initially, I wanted to be an astronaut, but it turned out I was afraid of heights, speed, fire, and small spaces. So I was back to the drawing board. My mom had been a nurse, so I knew firsthand that nurses were brilliant. But the clincher for me was when Ontario went to a Bachelor of Nursing Science entry to practice. And it seemed like the right time. It was going to be the right balance for me of science and service. And I bought into a vision for nursing where the profession was about to expand the already significant contributions to the health of not just patients in the hospital or communities, but to populations and to the world. And within a month, so I applied and I got in, and within a month of my first Nursing 101 class at Queen's University in Kingston, Ontario, I was on a road trip to Ottawa to go to a Canadian Nursing Students Association conference, and absolutely not something that I would have done in my previous degree, but I had a different sense of urgency to belong and contribute to this profession. My vision for the profession was absolutely validated during those 3 days, because we learned about, discussed, and debated important health and social policy issues that nursing was uniquely positioned to advance. And I was so glad that I had said yes to that opportunity, and I committed to continuing to say yes to opportunities throughout the rest of my career. When I graduated, I moved to Ottawa, and I had been hired into a new graduate transition program for the ICU, and I got the last spot, or so I thought. The winds of happenstance landed me on the neurosurgery ward instead, as they miscounted the spots for that cohort. And the transition to that unit was a very different experience. It was hard, and I couldn't see my vision of nursing and what I was doing, and I felt like I was drowning every single day, and I nearly quit within 2 months. And I would have, for sure, had I not had made the really great decision of buying a brand new Jeep before I received my first paycheck. But I managed to keep my head above water for the first 6 months. And by then I was in charge, and not by any exceptional performance on my part, but just ended up being the most experienced person on the floor one night. And on that night, I walked past a room with one of the newer nurses struggling and with a new lumbar drain. And I stopped in and asked if I could help, because I said, I just learned how to do that yesterday. And now the patient wasn't thrilled to hear me say that, but an early lesson in transparency, but the nurse was so appreciative. I still remember it. I'd literally been there the night before struggling when a nurse walked on past, and I didn't understand it at the time. But that's when I became motivated to try to make things better for nurses. A little while later, I moved to Calgary, and now passionate about neuroscience nursing. I found myself on Unit 112 at the Foothills. Totally different experience to my first day in Ottawa. I'd been assigned a buddy who was to be my mentor for the first 6 months to show me the ropes, but also to integrate me into the social structure of the unit. Quickly became a safe space to ask questions, to laugh, to share experiences, but maybe most importantly, to question practice. And after about a year, I started a journal club, and we'd have the physicians and the nurse practitioners, allied health or nurses would present some evidence on a topic and discuss, and usually pizza. So it's hard not to call that a good time. Now at first, not everybody thought that was cool, and there was definitely more eye rolls than people at the first one. But because the leadership on that unit had invested in creating a safe culture, it helped make it okay to try something different. In order to improve healthcare and the health, we absolutely need to create cultures where it's okay to say, I don't know, okay to ask questions, to challenge things, to learn. And not only is it okay, but it's our professional responsibility to be better today, better tomorrow than we were today. And in order to do this, people need to feel like they belong and like they're valued. A policy can't do that. A mission statement can't do that. That needs to be us making a decision to do that. So I started my master's not long after that, and that's when I started to think more about the system, not just about the patients, but the populations of patients. What did they have in common? What interventions might there have been to have kept them from acquiring a traumatic brain injury or spinal cord or a stroke in the first place? What happens to these patients when they leave to their families? Nursing was everywhere. And about a year in, Michael Sudas offered me an opportunity to join the Calgary Stroke Program as a quality improvement specialist. And I said, I don't know what that is. And he said, yes, you do. And saying yes to that opportunity changed my career. I got to work with some of the most brilliant people working in healthcare, in my opinion. And as a result of these committed people asking questions, wanting to improve care, make it more centered around the patient and around the providers, this group of individuals accomplished what I think is a phenomenal amount of improvements to healthcare locally, provincially, and nationally, just a couple of years. And that's just how long I was there. They're still doing it. And the lesson I learned there was surround yourself with the people that care about the things that you care about. And they won't just be nurses. And because this is where I learned the value of each of those allied health and medical disciplines and how the professions are meant to be complementary to one another. But far too often they do not. But they can if we reprioritize what we're trying to do in healthcare around the patients and population health and properly utilize all of the professions. So next I went to the operating room at the Foothills to work as unit manager. Kelly Chapman took a chance on me and hired me as an outsider. I wasn't an OR nurse. I had worked briefly in the OR in Ontario, but I wasn't an OR nurse, not by many people's standards. But I was hired to lead. And this is where I started to pay attention to elements of what I think we now call emotional intelligence. Empathy was a big one. Self-awareness was another one. If I was going to have any chance at leading in this environment, I needed to have empathy for the people in that place where arguably I didn't necessarily belong, and empathy for their resistance to perhaps trust me or the things that I wanted to question. Empathy about the fact that nurses are people and have their own struggles, personal and professional, and that bad behavior and poor practice are often symptoms of something else. And self-awareness around what you say and how you say it goes a long way, and it really matters. And if you want to be a trusted leader, you need to give people a reason to trust you. The last bit of the journey to date, I'll call professional leadership. So my experience as a provincial counselor for the College and Association of Registered Nurses of Alberta, and now as senior practice lead with the Associate Chief Nursing Office at AHS, and find myself asking questions like, what does the profession need to best serve the public? What is professional practice? What does it mean to be a profession? What is scope of practice? What is my philosophy of nursing? How do all of the parts fit together? How does a decision around a regulation change impact the recruitment and education of nurses, impact the recruitment, retention, and development of professional nurses in the workplace, impact the outcomes of the services they provide? It's complicated, but it's kind of beautiful too. And often you don't have much power. So how do you advocate for change without power? Well, you influence where you can by being aware of your own intrinsic bias and other people's biases. And you ask questions, you ask why, and you seek to understand. And hopefully, more often than not, we do the right things. The system is always changing, has always been changing, but faster now than before. It was once a very top-down, physician-centric system, which arguably was appropriate at one time, but it's evolving quickly to be a more patient-centered, collaborative, and improving care system, constantly improving, where we care more about the right person getting the right care or the right provider at the right time. And so why do I say this, and why is this relevant here? Well, because it's changing the expectations of all levels of leadership, all levels of nursing leadership. We're all going to be called on to help design and improve the system. So when the opportunities start to present themselves, and they will, you have to say yes. And when the doors start to open for you, doors that maybe weren't open before, doors that maybe you didn't know were there before, walk through them. Try it, learn, and spread the word, which brings me to my 3 lessons. Try something new, learn something new, Teach it to someone else and repeat. Start today. Big or small, it doesn't matter. But we need to do this together. So maybe start with that colleague that can't see their vision of nursing anymore. There's 1,001 reasons why they may have lost that vision along the way. And those are among the things that we all need to work on resolving. But to start, help them find it again. Help them see the value in what they do and what they uniquely bring. By saying yes to opportunities and keeping, though readjusting at times, my vision for this profession. I found myself with the launch of the Nursing Now campaign in Vancouver in 2009 in a room full of my nursing heroes looking towards the future. And absolutely one of the highlights of my career is for sure. But Annette Kennedy, president of the International Council of Nurses, said this: work hard, save the world, and let's have a little fun while we do it. So try something new, learn something new, teach it to someone else and repeat, and we can do it. Thank you, and happy Year of the Nurse.
Good morning. My name is Faduma Robinson. I'm the Associate Chief Nursing Officer of Alberta Health Service. I am honored to be with you this morning. What a creative way to continue learning and sharing and collaborating despite the pandemic we're all learning to deal with. When I was asked to be part of this conference, I took some time to reflect once again on my leadership style and how my leadership style has been influenced by my personal experience. I came to Canada as a refugee in my teens after living in many parts of the world and in many different cultures. That experience has had a profound impact on who I am as a person, how I view the world, how I view human relations, and therefore it has impacted my leadership style. Like many leaders, over the years, through education and personal interest, I've read many leadership thinkers and philosophers and experts. One of my favorite leadership thinkers is Robert Greenleaf and his concept of servant leadership. Despite that, I keep coming back to with a deep belief that how we lead has a lot to do with who we are than we often think. After coming to Canada and several years later, I started my formal education and obtained a degree in criminology, a degree in social work, a degree in nursing, and subsequently a graduate degree in nursing leadership. As a social worker, I worked in many human services, such as family violence prevention. I worked in corrections. I worked in mental health, both in community and inpatient. As a nurse, I worked in medicine, surgery, seniors care, rehab, and later as a professional practice lead. That led me to my leadership journey, which has been for the past 15 years now. That early experience of being a refugee, a marginal individual, a young person navigating through a different culture, as well as my diverse education in multiple settings, has given me a unique perspective on service, those of us who serve, who we serve, how we serve, and often the gap between how we're serving and how our service is received. Therefore, I came to the conclusion that much of who we are and how we lead are intertwined. And I would say I would say that we should be maybe weary when we hear this dichotomy of leadership personality and your normal personality often is truly one in the same. As a result of that combined experience of my personal and my professional and education, I've developed a unique approach of leading. That approach is the concept of systemic thinking, that everything we do, the personal is the political. What we do individually touches many others, and we're interconnected, and the importance of understanding that interconnection within a system and to the society. The idea of having diverse voices around yourself, and the concept of continuous growth and continuous quality improvement. That is essentially the foundation of my leadership. There are 3 key points I would like to leave with you as you think about your own leadership journey, the path before you as you graduate from nursing, whether you're undergraduate or a graduate student, and as you reflect on your own leadership. The first one is clarity of value. The second one is be intentional about your circle. And third would be curious. Let me say a little bit about each of these. Clarity of value is, in my opinion, imperative to being authentic leader, being resilient leader, knowing what values we have and hold dear, what's important to us and why, where our ethical boundaries lie, what gives us joy in our work is important in being true to yourself, but also knowing when you have violated your own ethical values. The second one is that being intentional about who you surround yourself with. That may give you a particular idea or image, but what I'm thinking more so is that it's important for us to have those who support us, who understand us, who make us feel safe. For sure, it's part of the human condition to want to be accepted, supported, and understood. But I would argue it's as important to have around us those who challenge us, who don't make it as easy for us, who require us to have more patience and more creativity to win them over. And finally, being curious about as much about your failure as you might be about your success. Constantly evaluating that and finding ways to grow. That is the key to lifelong learning. I thank you for this opportunity. May this be an enjoyable experience, challenging one. You may be intrigued and inspired. All the best to you in this conference, and with many gratitude, thank you.
Good morning. It is an absolute honor and pleasure to be part of the University of Calgary Faculty of Nursing Leadership Day virtual conference, the leader in all of us. My name is Michelle Charlesworth, and I've been in nursing for 24 years. My dream to become a nurse started at the age of 5, and I cannot imagine doing anything else. This morning, I'm going to share how my background and my experience has shaped the kind of leader I am and inspire you to consider the type of leader you want to be. I graduated from the Northern Nursing Program through Aurora College in Yellowknife Northwest Territories. I was fortunate to be part of a Northern Mentorship Program, which allowed me to start my nursing career doing outpost nursing in various communities across Nunavut. I lived in Baker Lake for several years. By the way, Did you know that Baker Lake is the geographical center of Canada? I later obtained my nursing degree from the University of Alberta. In addition, I am currently finishing my master's degree in health studies from the University of Athabasca. Working in rural remote communities taught me to be resourceful and network within the larger community to provide health services for the entire spectrum throughout the lifespan. I learned a lot about being culturally sensitive to truly listen to my patients and provide patient family-centered care. My first manager, the nurse in charge of the Baker Lake Health Center, she was my mentor, she was my coach. She played a huge role in shaping the nursing leader I am today. She challenged me and taught me the importance of creating a continuous improvement culture. Whether it was researching the evidence-based practice to support chronic disease management, to being prepared of how to assess and treat a patient with hypothermia. I faced many stressful situations. For example, when there were blizzards and a medevac plane could not land in the community in order to pick up a patient that required transportation to an acute care facility for medical services. This is when I learned to love problems and to see them as opportunities. I am forever grateful for the experience I had with rural nursing. Moving forward in my career, I've spent the last 14 years in Alberta working in the area of supportive living and long-term care. Currently, I am one of the resident experience directors with Covenant Care and Covenant Living, a nonprofit Catholic organization. I oversee operations for our homes both in Calgary and Lethbridge, consisting of supportive living, hospice, and independent senior housing. I am driven and passionate to serve our residents, family, and staff. I put my passion into practice by making personal meaning of my organization's mission. Meaning, my translation of our mission is that my mom could live at any of our homes. If I'm not comfortable with that, then I need to scream from the mountaintops until she can. I share this personal mission with my teams and also ask them to scream from the mountaintops. We need to support a culture of safety. We as leaders need to be advocates and question the status quo. Life is far from perfect, and we need to learn to value our failures. When I reflect upon my nursing career to date, my failures have shaped my continuous learning and growing. The story I will share is in regards to our global pandemic. Leading in unprecedented times calls for not only thinking outside of the box, but thinking that there is no box. As leaders, we need to ensure we have the resources and tools to do our jobs. Although this can be a huge challenge when we're working with many uncertainties and unknowns during a pandemic. A couple of weeks ago, one of our homes in Edmonton on a COVID-19 outbreak was negatively impacted. Without hesitation, I decided to put my many competing priorities on hold, including my schoolwork, and made all the necessary arrangements to go to the site. The hours were long and exhausting, but so fulfilling. I needed to be flexible and not to think of titles or roles, but rather what needed to be done to meet the basic needs of our residents and how was it going to be done. The key ingredients were collaboration and teamwork. As my coworker would say, it was all boots on the ground. I supported by scheduling staff, recruiting staff, leading the site command center, assisting with care, ensuring staff had breaks, food to eat, in reviewing the IP&C practices, and providing education. In leading from up front, many of my direct reports from several other homes felt encouraged and empowered also to come and serve. Leading through our actions gives us credibility to who we are and what we say. Yes, I felt tired, But as I review the list of individuals who followed without fear, I am glad to be a leader who is not afraid to step out in the light and the darkness, to lead from a base of strength. I am a leader who leads from up front. The kind of leader I am. John Maxwell wrote, "Leadership is influence." Those words are simple, powerful, and gives me focus. And wow, are they challenging. Having influence is an ongoing learning journey that starts with me. One way to influence can be through coaching. Leaders can utilize informal coaching as part of their day-to-day practice to influence. Coaching is not a one-time thing, but is the ongoing process of influencing behaviors to support growth. Coaching and mentorship are frequently used interchangeably or grouped together, which I did earlier when I was talking about my first manager. Although it is important to understand there are differences, and there is some overlap too. Work done by Waldrop and Duran describe coaching as supporting another person in achieving performance goals by providing guidance and ongoing support. This differs from mentorship, a more familiar term, possibly, and that focuses on specific aims rather than general professional development. For an example, a leader should not tell a coworker or an employee what to do in order to save time, but rather ask probing questions to enable learning. It is vital that we self-reflect and we do not demonstrate behaviors that impede coaching. As well, it is imperative to believe those we work with are capable and willing to grow and develop. I hardly ever think that I'm leading. I rarely ever think of leading. I'm more acutely aware of fulfilling my roles and responsibilities as an employee, mother, daughter, friend, and human being. Focus on relationships and connections to support the delivery of safe quality care. There are 3 key areas in our leadership practice and personal growth which we can challenge ourselves to strive and grow, develop, and monitor on an ongoing basis. These have been huge for me, and I'm confident they will have a lasting impact for you too. They are, first, we will lead through words. I aim to utilize coaching, mentoring, and encouraging words. Secondly, we will aim to lead through attitude. Attitudes are like colds, they're contagious. I am constantly monitoring my attitude in every situation to ensure integrity and transparency, to be purposeful in being positive, and to break down the downward spiral of negativity. Thirdly, we will aim to lead through actions. I have learned there is always something that can be done, even if it is something small. My challenge to you is, remember, leadership is influence. I encourage you to lead through your words, through your attitude, and through your actions, to reflect and assess the words you use, to reflect and assess your attitude, to reflect and assess your actions. As well, be open and ask for feedback and adjust accordingly. As well, be authentic in your leadership style. Be vulnerable and create an environment where it is safe to learn from our failures. Finally, be that coach and mentor that I had when I started my career, who influenced who I am today. Thank you and have a great day.
Wow, thank you. Thank you, panelists. That was fantastic. And thank you for sharing your insights into leadership. I see a lot of positive feedback in the comment section. And I just have a question for Tyler. I'm just wondering if you have any advice on what to do if the culture on a unit isn't so supporting of challenging the status quo.
Yeah, that's a great question, and I don't know that I have a perfect answer for it, but I would suggest, start by reflecting on why that might be. It's our job as nurses to sort of seek to understand, and again, that back to that empathy piece, try to understand why the culture on that unit came to be the way that it came to be, and because there'll be a reason, there'll be lots of reasons likely. You didn't just wander into a lion's den filled with people that don't care about the people that they serve. So there will be reasons. So try to seek to understand what those are, and find an ally, and build relationships. I think are important ones. Talk to your leader on the unit. The culture, within my organization is such that I've not come across a unit manager that doesn't care about making things better. So talk to them about what you want to do, and they might be able to help you find some space to do that. So just try to understand why that might be, and meet them where they are, and find an ally. That's my thought on that.
That's great advice. Thank you, Tyler. Especially as a newer nurse, I really appreciate your insight on that. And I also have a question for Michelle. You speak about coaching and again, the importance of self-reflection, and that's really great advice. Why is coaching so important to leadership, do you think, for your practice, Michelle?
Thank you, and a great question. I think first of all, I would start off by saying to build capacity. I see coaching as an enabling process to really help individuals or colleagues or those we are working with to reach their potential, and to help them in a way that not what I need, but what they need, is why I see coaching as really important. Also, the research really shows that we as leaders are not taking the time to coach and to utilize coaching as a leadership development tool. So I think we really need to take a step back, and even though in our busyness, create that time to develop our people through coaching for that growth and learning. I think that's where we can foster that environment where diversity is really important, and to encourage all of us. We all bring unique gifts, professional gifts, and how can we foster that continuous learning?
Thank you, Michelle. We have a question in the chat from Kelly. I don't know if it's directed as a specific panelist, so maybe feel free to speak up, or Fadumo if you want to answer this question, because you haven't answered the question yet. The question is, it's sometimes difficult to always be a leader. How do you cope with that?
Yeah, I would say I think we're always leading. Sometimes it's difficult to lead, though. I agree with the question. I would say when you find that you're having a hard time leading is probably when your value is at risk potentially. There's misalignment somewhere. And I mean, I'm thinking of outside of normal stressors that as humans we might face. If there are no personal stressors per se, but you're still finding it hard to lead, I would say maybe it's time to step back and look at if your value is being violated and you feel you're not going the right direction. So that self-assessment as a start is the first step. And then, of course, your personal well-being is really important, especially now when we are in a very challenging times. Taking care of the self is really important.
Thank you.
I hope that helps.
Thank you. And I'm just wondering, Fadumo, what do you think the biggest challenge that we're facing in nursing is in the next decade?
Yeah, I think there are a number of challenges as well as a number of opportunities. And of course, many of the challenges can also be opportunities. Nursing is growing, the family of nursing is growing, the role of nursing is shifting in an incredible rate. I think the biggest challenge we're facing is not having direction and planning as a profession, as a field, about what the future could look like, and sort of going with the flow of the healthcare needs, and not intentionally placing ourselves ahead of the curve and actually influencing where nursing goes rather than sort of being more responsive. I think they're both necessary. It's important to be responsive to the system's needs, but it's also important to think ahead and place ourselves in the head of that system and influence the change. So that's a big one. I think, you know, historically and by and large currently, nursing is truly, I think we've all heard these concepts, but truly it's the glue that holds the system together. Nurses spend most time with patients. We influence healthcare in a way that often isn't necessarily fully articulated. Understanding that and the power associated with that and the impact we can make once we recognize that and put the hat on to influence the system. So if we don't take those opportunities, I think our role could be diminished, and that would be a serious risk.
Yeah, absolutely. To the other panelists, do you have any insight as well as what you see some of the challenges that we're facing in nursing in the next decade? Either Michelle or Tyler, feel free to chime in. We have another about 9 minutes left for questions, so.
Yeah, I think that's you know, Fadumo touched on a lot of the important ones. Is we absolutely need to continue to have that vision for the profession and what this profession isn't quite yet, in my opinion, living up to its potential. There, you know, we're, I think, got arguably the most well-educated health workforce in the history of the world in Canada and certainly in Alberta, and I think the opportunities are boundless, and so we really need to find ways to make the best use of that workforce and be moving towards the future and what are the health needs over the next century going to be, and have nursing at the center of that so that we can make our populations healthier, not just here in Alberta, but again, the world will become, the work that we do, I think, will become more global. And so we have to think more about that and be a bit more strategic in what the profession's response to that will be. So we really need to get organized about that, I think.
Mm-hmm. Yeah. Michelle? Oh, you're muted, Michelle.
There. A couple of thoughts. One area is really, I think, moving from that resident family-centered care to people-centered care. And instead of doing for, how are we doing with? And really having our people as we're partners and enabling. So I think that, and then along with that comes with that diversity and inclusion. And how can that be an opportunity? I think we're doing lots of work in that, but is an area that we can really address and do more in as we move forward.
Thank you.
And maybe if I may add one more thing, I would love to see more nurses in quality improvement, for example, in healthcare quality improvement. If you look at nationally, majority of healthcare quality improvement teams are not nurses. There might be one or two nurses. Nurses have deeper understanding of the system. And I would love to see, so for the 197 nurses on this call, I encourage you, and I encourage you to encourage others to support nurses to go more into quality improvement. I think that's the way in 21st century, that's the way to transform the system, obviously through research and academic endeavors, as well as at the point of care, but quality improvement is a big area, and I would love to see more nurses in it.
I'm just going to segue from that. I couldn't agree with you more. I think we really, an opportunity is to move away from that individual blame and look from that systems and quality improvement. And I think as nurses, we have so much opportunity for that quality improvement to build sustainability and even from that bottom up approach. So excellent point.
Thank you. And we have a question from Elizabeth Keys. What are some first steps that nurses can become involved in quality improvement at point of care? I think that question's for anybody. Go, Michelle.
I'll take that. I think one really good example is quality improvement teams. And really that can be set in any team or unit or whatever your structure looks like, and develop a clear terms of reference, have a chair, and have it purposeful. And even really going back to what I said earlier of that people-centered approach, look at who the representatives are of having maybe a family or a resident as part of it. And I think sometimes with quality improvement, it becomes so daunting that we almost don't want to start. So I think going back to earlier when I said in my presentation, there's always something little we can do. And it's the stacking impact of all the little things that have an impact on the huge system where it organically happens. So going back, I would say quality improvement teams is a really easy way to build collaboration and to look at that continuous quality improvement.
Yeah, really well put, Michelle. And I would add, at least within Alberta Health Service, there are many small introductory courses on My Learning Link. For example, I think Covenant Health has similar system that would expose you to quality improvement within, they range from half an hour to 4 hours. So that's a good starting point. Also throughout Alberta Health Service, we have quality councils in most programs, most sites. So I encourage you to find out about that. Once you have some of that basic introductory to quality improvement processes, you can actually work with your team and your leadership on your particular practice setting to look at your workflows and to look at how care is given in your area and see what could be improved. Just small steps towards that.
Leah has a comment. She says, I completely agree, but these quality improvement positions tend to be posted within HS in the HSAA portfolio, which I feel really puts many of us at a huge disadvantage. And she's asking if you have any suggestions.
My thought, sorry, go ahead.
Please, Tyler, go ahead.
And that's certainly been part of the journey towards embedding quality improvement culture across the organization. You've seen historically over the last 10 years, a lot of these roles that were formal sort of quality improvement roles. My preference and vision for the future would be that we would build that capacity or capability within the teams in those clinical areas, like the other two have suggested here, and build that into the work of your unit. And that's part of what you do as a nurse on that unit every day, is to continuing to keep it centered, anchored around the patients and what they need and want, and how are you constantly understanding and improving the work that you do. And so, hopefully there will be opportunities, and if not, try to seek them out or help develop those units, opportunities within your own unit. So you don't have to leave that clinical area if you don't want to.
Thank you, Tyler. I think we have time for maybe one last question, and this is from someone, their name's not on there. How do we encourage and create confidence in undergraduate nursing students to be advocates about their role and contribution to broader systems improvement? And that's for anybody.
Yeah, maybe I'll tackle that one first. What a such an important question. I think how undergraduate nurses are educated is the first important step, but as important is how they are transitioned into practice. And I would admit, I think we have some room to improve on that, both at the system level and at the individual nurse level. I think there needs to be an onus on every single one of us to make a point of ensuring that it's supported, nurtured process of transitioning young nurses, young or old. I was older, new nurses into nursing. So I think it needs to be a professional commitment. It cannot be something that's left to employers alone. Employers have a very important role, but I also think we have a professional commitment to support new members to our field. So it's a broad conversation, but those are the two key things. System has a role, but we also have a role.
Thank you so much. I'm just going to wrap up so that everyone gets a chance to take a quick break before our next session. So thank you again so much, Tyler, Michelle, and Fadumo, for sharing your insights and contributions on this topic. I really appreciate how all of you really spoke to the importance of self-reflection and emotional intelligence, and I think that's super important going forward in nursing, so thank you. Just a reminder, everyone, if you can change your Zoom name to make sure it reflects your actual name or just your name, and that makes sure that we know who's engaging and who's with us today as well. Yeah, so thank you again to our panelists. We'll just take a short break before we come back at 11. And we're going to play a short video from our sponsor, Vessi. And remember that there's 2 people that are attending that will walk away with 1 pair each of Vessi shoes. So we'll play a short video, take a quick break. And thanks everyone for your patience as well as we figure out how to run a Zoom conference in the middle of a pandemic. So thank you for your patience. If you're not able to edit your names, I think you can message Amber Porter and she can change your name and she'll make sure that it reflects your name. All right, so make sure everyone takes a break. We're gonna play that Vessi video and then we'll come back at 11 as well for our next session. Thank you, panelists, again.